TMJ treatment, what it looks like when you come in to see me, or maybe Jose, some of our practitioners here. So first of all, reminder, your TMJ is right here. And when you come in for a manual therapy treatment, we've decided it's definitely TMJ. We're gonna work with the whole body because it's not just here, the whole body is connected. How the alignment of your spine is gonna affect how the occiput sits, which is then gonna affect how the temporal bone is placed, and then the TMJ, and your mandible, your jaw. So we use a handful of techniques. We have a lot of tools. We'll definitely use some craniosacral therapy, which will help relieve some of the cranial pressure, help with fluid flow, help with movement of the bones. It's very gentle, but it still helps relieve the restrictions, and it's a little bit of fascial release, and it's going to connect the pelvis to the head. Then we definitely want to use some fascial release. And when we're getting fascial release, we're getting a little more specific into the muscles. So we're going to work through the masseter. We're going to work through the temporalis muscles right here, deep into the medial and lateral pterygoid. We're also going to work into the SCMs, the scalenes, the cervical muscles, maybe into the pecs as well, because we have to look at the posture. We're going to look at the posture. If you've got forward head syndrome, rounded shoulders, it's going to impact how your TMJ is aligned. And so we're going to look at all these areas. We're going to do some cervical work, make sure that we've got nice full range of motion, because when your body doesn't have range of motion at one joint, it will borrow movement from another joint to make sure you can still do the activity you're trying to do. So we have to look at all of it. We're going to do intraoral work. So coming inside, getting deep in here into your medial and lateral pterygoid. We're also going to help mobilize the hard palate. So in this area here, we're going to distract the maxilla bones. We're going to come in here and make sure that the vomer and the palatine are moving and that the maxilla is moving, so on the teeth. And then we're going to do some trigger points to help relieve the referral pain that we get to our teeth, to the temporal area that causes headaches, and gentle mobilization to facilitate glide at the TMJ joint. So a whole bunch of techniques. Sometimes we don't use all of them. Sometimes we use all of them. It's always within the client's comfort. So you are in charge, you lead the treatment, and we work together to make sure that you come out with the best outcome. If you have any questions or comments, please leave them down below. We are here to assist you on feeling your best and moving and grooving however you want to live. Thank you.